Glaucoma simplified for patients in Ghana. If you are a glaucoma patient, kindly watch or listen to this report carefully so that you can understand your treatment.
The Bosompem Foundation is paying for free glaucoma surgeries with the hope that glaucoma patients no longer use eye drops. So, what that means is that the Bosompem Foundation is paying for the full cost of the minimally invasive glaucoma surgery. The foundation is bearing the full cost of the eye drops to be used for the surgery and the spectacles to be used after the surgery. All the patient needs to bear is the cost of his food and lodging at the Dr. Rose Mompi Hospital in Pando.
The glaucoma operations will be done at Dr. Rose Mompi Hospital in Pando, where patients have to stay for about 2 weeks. Checkup by the U has eye team before and after the operation is available in Accra, Ho, and Pando every Monday and Friday. After the operation, checkup will also be available in Kumasi and Karsua on specific dates given to the patient after the operation. In Accra, visit the Sanford International Clinic in the Powerland area near the Ritz Junction, on the road from Medina to Adenta. Sanford eye testing fee is 200 cedis. In Ho, visit the eye clinic of the Ho Teaching Hospital or Trafalgar. Your NHIS card is accepted. In Pando, visit Dr. Rose Mompi Hospital at Global City. Eye testing fee is 100 cedis. Let's talk about the charges for the glaucoma operation. Patients who are financially comfortable are not sponsored by the foundation. Such patients stay in private rooms with a helping friend. They pay the full cost of surgery, drugs, dark spectacles, daily eye testing, accommodation for 2 people, and food for 2 people for about 2 weeks at a cost of 10,440 cedis. Low economy patients stay in a public room and get free glaucoma surgery, free drugs, and free spectacles sponsored by the Bosompem Foundation. They pay for daily eye testing, accommodation for 2 people, and feeding for 2 people for about 2 weeks at a cost of 4,440 cedis. Very, very poor patients only pay for food for 2 people for about 2 weeks and daily eye testing at a cost of 2,440 cedis.
My name is Nana Puku Bosompem, a glaucoma patient and the founder of the Bosompem Foundation. Among other glaucoma patients that you'll be listening to in this video is Dr. Kontiba, a top eye surgeon in Ghana, and Professor Eliasson, the Dean for the School of Medical Science, University of Cape Coast. All of us have successfully undergone the minimally invasive glaucoma surgery introduced by the University of Health and Allied Science.
My name is Dr. Thomas Tuntiba. I am an eye surgeon and ophthalmologist. I'm also the founder of Save the Nation Sight Clinic.
My name is Professor Sebastian Eliasson. I'm the Dean of the School of Medical Sciences, University of Cape Coast.
I was first diagnosed in glaucoma some 10 years ago, and ever since I have been managing the eyeball pressure with eye drops for some time, until the drops no longer work for me. I had an option of a surgery. I opted for the UHAS minimally invasive glaucoma surgery. This surgery was painless, there were no injections to the eye, and at the end of it all, I no longer depend on eye drops. I have never used eye drops for over a year now.
I've been in the forefront of the fight against preventable blindness. Unfortunately, 10 years ago, I developed glaucoma myself, and I've had to go to many places for treatment. Yet, the pressure was still always very high. I heard about the UHAS minimally invasive glaucoma procedure at home and went there for the operation. Ever since the operation, my pressure has come down. I no longer take any eye medicines or eye tablets, and I look very fine. I want to encourage anyone with glaucoma problem to go to Ho for the procedure.
I've been living with glaucoma for the past 20 years and have been on eye drops ever since. I heard about the UHAS minimally invasive glaucoma surgery and I went for it, and I have not regretted so far.
Yes, folks, as you can see, we are not the only beneficiaries of the UHAS minimally invasive glaucoma surgery. A lot more people have benefited from this glaucoma surgery. We can talk about the likes of Professor Colonel retired Edwin Afare, former commander of the 37 Military Hospital. We can talk about Togbe Teprehoda, the fourth president of the Volta Regional House of Chiefs, Reverend Joshua Tamaklu of the Assemblies of God Church, and Dr. Radford Entry, Dean of Arts at the Central University.
Glaucoma simplified for patients in Ghana. If you are a glaucoma patient, kindly watch or listen to this report carefully so that you can understand your treatment. By the end of this report, you should understand that sight is only possible when the eye has a good connection to the brain. You should also understand that the connection between the eye and the brain has a number of cells which decreases with age, and further decreased by a number of diseases including high eye pressure, which we all call glaucoma. You will also understand how a severe decrease in the number of cells in the above connection leads to permanent blindness, and how an attempt and successful decrease in eye pressure delays the development of permanent blindness. We will also mention the risk factors for glaucoma and the methods available for the diagnosis and treatment of glaucoma, with the hope of delaying the onset of permanent blindness. How does the human eye see and understand what it is seeing? The eye sees because the eyeball receives the light, then the optic nerve, which is the connection between the eye and the brain, transmits the light message to the brain for analysis and understanding, and then the human being can see and understand the light. If the optic nerve is destroyed or fails to work, we lose our ability to see and we become permanently blind. The most common disease that destroys the optic nerve is glaucoma. Other problems that commonly affect the optic nerve in Ghana are hypertension, diabetes, excessive alcohol intake, and the side effects of some pharmaceutical and herbal medicines. At birth or in childhood, the optic nerve has about 1 million cells that transmit the light message coming from every direction in your visual field to your brain. The brain receives all the light messages from all the cells and analyzes them to form a mental image of what we see. For example, boy or girl, table or chair. As part of the natural aging, every human being loses about 1% of the 1 million optic nerve cells every year as we get older. Hence, by calculation, the optic nerve can only last for about 130 to 140 years, after which the cells get finished. However, only few humans live beyond 100 years. So we die before the optic nerve cells get finished, and we don't notice any blindness. Now, this is where the problem begins. Some people in the population lose their optic nerve cells at a rate of 2%, 3%, or even more every year, instead of the normal 1% per year. So by the age of 30, 40, or 50 years, their optic nerve cells get finished and the eye becomes permanently blind. The people who are losing their optic nerve cells at a higher rate per year are called the glaucoma people. In the glaucoma people, doctors discovered that the pressure in the eye was too high for their optic nerve cells, and consequently, more optic nerve cells were lost every year. Doctors also discovered that if something was done to reduce the eye pressure to comfortable levels, the glaucoma eye becomes like the normal eye and loses its optic nerve cells at the normal 1% per year like everybody. So in glaucoma patients, a higher number of optic nerve cells are lost every year than in people who don't have glaucoma. Doctors give medicine or do surgery to reduce the pressure in the eyes, hoping to reduce the number of optic nerve cells lost every year to the normal 1%. So in effect, doctors can only slow down the vision loss in glaucoma, but cannot stop the vision loss completely. So even with the best treatment, if a glaucoma patient is blessed with a long life, the patient can still go blind because the optic nerve cells get finished with age as we get older. Now let's explain why glaucoma patients develop high pressure in their eyes. The water in our eyes gives pressure to our eyeball to make it firm, just like air in a football gives the ball pressure and makes it firm. Without pressure, the eye will be too soft and shapeless. Too much water staying in the eye gives the eye a high pressure. The water in our eye is not stagnant. Water continuously moves into the eye to nourish and clean the inside of the eye, and then the used or waste water leaves the eye through a sieve channel. In glaucoma patients, the used water is unable to leave the eye quickly for various reasons, and this causes pressure to build up in the eye. The higher pressure in the eye kills the optic nerve cells faster, so doctors treat the eye with medicine or operate the eye to reduce the inflow of water or increase the outflow of water, leading to a reduction of pressure in the eye. How does glaucoma cause permanent blindness without early warning signs? Glaucoma is a serious eye disease affecting over 100,000 Ghanaians. It is caused by damage to the optic nerve, usually due to increased pressure in the eyes. Without treatment, it usually leads to permanent blindness. In the early stages, there is no pain nor blurred vision in most cases to serve as early warning signs. So the patient is not aware of any problem or loss of sight until it is too late. This is why glaucoma is called the silent thief of sight. Thus, the diagnosis of glaucoma is usually done during public screening exercises by eye care workers or screening for glaucoma when a patient reports to the eye clinic for any other reason. To make a diagnosis of glaucoma, the doctor checks your eye pressure, abbreviated as IOP, looks at your optic nerve, called funduscopy, scans the optic nerve, abbreviated as OCT, and analyses your visual field, abbreviated as VFT. These same checks are done at regular intervals to monitor the worsening of optic nerve damage or successful treatment of glaucoma. This regular comprehensive eye examination, especially for those at high risk, is vital for the early detection of glaucoma. With proper care and vigilance, many glaucoma patients live their full lives with good vision. What are the risk factors that will alert you to become more vigilant? These are a family history of glaucoma, high eye pressure, increasing age beyond 40 years, people of African descent or Black people, and people with hypertension or diabetes. You have a high risk of developing glaucoma if your mom, dad, brother, or sister have suffered from glaucoma or have lost vision due to glaucoma. You have a higher risk of developing glaucoma if your eye pressure is high and above 21 units when checked at the eye clinic. However, some glaucoma patients have eye pressure less than 21 units, meaning that their optic nerve cells are unable to withstand the pressure that we have assumed to be normal for everybody. Glaucoma affects children and even babies, but it is far more common in adults above the age of 40 years. The older you get, the higher the risk of developing glaucoma. The Black race has the highest glaucoma risk, and Ghana is one of the countries with the highest number or proportion of glaucoma patients in the world. Uncontrolled diabetes and hypertension will also increase your risk of glaucoma as part of the complications of diabetes and hypertension in the eye. How do we treat glaucoma in Ghana? Majority of doctors prescribe eye drops to control the eye pressure. There are 4 different groups of drugs used in Ghana. Each group helps to reduce the eye pressure for a few hours, so these eye drops must be used by the patient for the rest of his or her life. For the different groups of drugs, we have the timolol, betaxolol group, the brimonidine group, the brinzolamide, dorzolamide group, and the latanoprost, travoprost group. The first 3 group are usually used in the morning and evening, and the latanoprost, travoprost group is used at night before bed. Some patients may need 1, 2, 3, or 4 different eye drops to control the eye pressure satisfactorily. Some patients in Ghana have difficulty in buying eye drops for the rest of their lives due to financial constraints. Some patients, for various reasons, may forget to use the eye drops according to the schedule. If the pressure is not controlled satisfactorily by the eye drops, or the optic nerve damage is progressing at a fast speed, doctors will offer the traditional glaucoma surgery called trabeculectomy. Glaucoma operations in general provide an alternative route for water to exit the eyes, leading to a reduction in the pressure in the eyes. We have the traditional glaucoma surgery called trabeculectomy. Trabeculectomy requires a lot of work to be done on the eye, so it is seen as very invasive, to the extent that in Ghana, it is usually reserved for patients whose eye pressure is not well controlled with eye drops. This traditional glaucoma surgery takes 30 minutes to 60 minutes to complete, has eye injections to numb the eye, and the use of scissors to dissect eye tissues. Eye injections and the use of scissors to dissect eye tissues are responsible for some of the complications that occur in the traditional glaucoma surgery or trabeculectomy. The newer minimally invasive glaucoma surgeries, MIGS, are less traumatic to the eye. One example of MIGS commonly used in Ghana is the UHAS MIGS introduced to Ghana by the Eye Department of the University of Health and Allied Sciences in Ghana. In the UHAS MIGS, there are no eye injections, no dissection of eye tissues with scissors, and the procedure is faster, taking only 10 minutes to 15 minutes to complete. My Joy Online published an online news report on how the U.S. minimally invasive glaucoma surgery saved the sight of a top Ghanaian eye surgeon who suffered from glaucoma. It is a very interesting report for glaucoma patients and their families to read. So does glaucoma treatment with eye drops or surgery cure the glaucoma? Every glaucoma treatment or surgery has the target of slowing down the loss of optic nerve cells so that the patient will have sight for a longer period than they would have had if there was no treatment. The sad truth is that because of the delay in diagnosis and treatment of glaucoma in Ghana, some patients will still become permanently blind even with the best treatment. I would like to encourage glaucoma patients to follow their treatment schedule strictly for the best control of their eye pressure, with the hope of keeping their sight for life. Thank you. Kindly share this video with everyone interested in knowing about glaucoma in Ghana.
Repeat that the Bosompin Foundation is bearing the full cost of the minimally invasive glaucoma surgery, the full cost of the eye drops that goes with the surgery, and the full cost of the spectacles. All that the patient needs to bear is the cost of food and lodging. No one needs to go blind as a result of glaucoma. Let's save the sight. This is really good news, isn't it? Yes, it is. So folks, kindly share this good news about the free glaucoma surgery sponsored by the Bosompin Foundation to all your contacts and friends. Who knows, you may save the sight of one person on the verge of total blindness as a result of glaucoma.